There's one hard truth I learned treating men over 60 that changes how we should think about aging. Sexual health is not optional. It's a vital sign of the body and mind. I say that as a urologist who has spent more than 15 years in clinic rooms, listening to men describe what they call getting old, and watching the same patterns quietly chip away at their vitality. This isn't about shame or morality. It's about physiology, neuroscience, and the practical steps that actually help men feel like themselves again. If this resonates with you, please subscribe and write yes in the comments. It helps me know this content is needed. Here's the idea in one sentence. After 60, sexual health is an indicator of broader health. Hormonal balance, cardiovascular function, neurochemistry, and mental well-being all talk to each other through sexual function. When one part falters, the others often follow. In my practice, I see 3 recurring errors that, alone or together, erode men's sexual health, and by extension, their overall health. I'll take each error in turn: a clinical vignette, a simple physiological explanation, and practical steps you can try. Then I'll give you a concrete, doable daily practice, a reconnection protocol, that many men have used to retrain their nervous system and regain confidence. The first error is autopilot, high-speed masturbation conditioning. I remember Don Hector, 67, who came in saying, "Doctor, with my wife it just doesn't work anymore." He was honest. Over decades he had recovered quickly by using a very fast, predictable technique in private. It got results in the moment, but over time his nervous system learned to expect that very high level of stimulation. With a partner, where touch is slower, variable, and bound up with emotion, his body failed to respond the same way. Here's what's happening in plain terms. Our brain and nervous system are plastic. They adapt to the patterns we repeat. If the signal you consistently give your body is fast, intense, predictable, the neural circuits that respond to that pattern become strengthened. That's useful in many contexts. But when sexual activity with a partner requires a different set of cues, slower touch, emotional connection, different timing, the old circuit doesn't translate. In neurochemical terms, dopamine peaks become tied to high-intensity inputs, so natural, lower-intensity stimuli seem less rewarding. Over time, this can look like erectile difficulty, delayed arousal, or a sense of disconnection during sex. Practical steps for this first error are simple but not easy. Tend to novelty and slowness. Start with awareness. Notice how you touch yourself, how quickly you move, and what sensations you prioritize. Then practice slowing down. A short micro-practice might look like this. Find a private moment, set aside 5 uninterrupted minutes, and intentionally slow your movements to half or a third of your usual speed, holding attention on simple sensory experience rather than goal-directed stimulation. No porn during this practice. The goal is not immediate ejaculation. The goal is re-educating sensation. Over weeks, you'll give your nervous system a new pattern to learn. The second error is the other extreme: total avoidance or prolonged abstinence from ejaculation and sexual contact. Don Roberto, 68, told me he had convinced himself that if he simply stopped entirely, everything would be safer for him. He avoided intimacy and even masturbation for long stretches. His concern was genuine. He feared age-related disease and thought abstaining would protect him. Instead, he developed lower urinary tract symptoms, a sense of pelvic discomfort, and worsening anxiety about his genitourinary health. Biologically, the prostate and the tissues around it produce and clear fluids continuously. When sexual activity falls to near zero for long periods, some men experience feelings of fullness, discomfort, or urinary urgency that can be linked to congestion and low-grade inflammation in the pelvic region. While we cannot claim any single behavior guarantees prevention of serious disease, clinical experience and some research suggest that regular ejaculation may help fluid turnover and reduce stagnation in the prostate environment. That phrasing is important, may help, because individual risk varies, and definitive causal claims would require more specific evidence than we can responsibly provide here. So what is the practical middle path? Reintroducing regular sexual activity, which can include masturbation practiced in a mindful, non-hurried way, can be framed as self-care. For men who have avoided ejaculation for long periods, start gently. Make sure you're in a private, comfortable place. Consider adding a warm shower, a brief walk, some pelvic floor relaxation. Aim for a pattern that feels regular for you, rather than a rigid prescription. If you have significant urinary symptoms, persistent pain, blood in the urine, difficulty emptying the bladder, or sudden worsening, that's a reason to seek clinical evaluation promptly, rather than self-manage. The third error is the silent epidemic: shame, isolation, and emotional withdrawal. Don Luis, 72, came in because he had stopped inviting friends out, stopped going to the gym, and slept poorly. His wife had died years earlier, and he told me he felt less of a man crying alone at night. He had slowly reduced social contact, avoided sexual topics, and told himself this was all just part of being old. Shame is biologically active. Chronic stress elevates cortisol, which interferes with sleep, reduces testosterone production, and blunts motivation. Low social contact reduces oxytocin and dopamine-driven reward from close relationships. Depression and anxiety further distort self-image and reduce the likelihood of taking healthy actions. In short, shame becomes a self-reinforcing cycle that affects mood, hormones, and physical health. The practical response to this third error is threefold. First, permission. You are allowed to care about your sexual health. Second, connection. Re-engage socially in small ways, a weekly walk with a neighbor, a phone call to an old friend, because those micro-choices matter for hormonal and mood balance. Third, clinical support. If you are experiencing persistent low mood, loss of interest, or thoughts of hopelessness, seek a mental health professional. Psychotherapy, social interventions, and sometimes medical treatments address depression and can indirectly improve sexual function by restoring emotional energy and motivation. Now, I want to bring these threads together with the tool I have taught dozens of men, a straightforward reconnection protocol. It's built on neuroplasticity, the idea that the nervous system can relearn responsiveness, and on the principle that small, consistent practices beat dramatic, intermittent efforts. This is a 10-minute daily practice you can do privately. Commit to 30 days initially to observe changes, and be patient. Progress is gradual. First, choose a private, comfortable space where you won't be interrupted. Make it a place you associate with calm. Second, begin with 5 deep, slow breaths, inhaling for a count that feels natural, and exhaling fully. The goal is to lower sympathetic arousal and bring attention inward. Third, bring intentional, slow touch to your body. This is not a race. Move with curiosity rather than purpose. Focus on sensations along the way. Fourth, practice non-goal orientation. Notice thoughts about performance or shame and let them pass like clouds. If ejaculation happens, that's okay. If it doesn't, that's fine too. Fifth, finish with 2 minutes of gentle breathing and a mental note of one positive thing you did for yourself that day. A sample session might look like this: 10 quiet minutes in the evening, 5 deep breaths, 3 to 5 minutes of very slow, mindful touch, focusing on noticing temperature, texture, and internal sensations, then 2 minutes of breath and a brief reflection. You're teaching the brain that slower, lower intensity inputs are meaningful. You're retraining dopamine responses and giving oxytocin and other affiliative neurochemicals a chance to re-enter your experience. What might you expect? In the first week, many men report awkwardness or discomfort. Old habits push back because neural circuits are powerful. In week 2 and 3, small shifts in attention and slightly increased ease with touch appear. By 30 days, some men notice improved sleep, slightly better morning energy, and a small but meaningful increase in confidence. None of this is guaranteed. People vary. But the consistent message is that repetition matters more than intensity. If you pair this practice with moderate exercise, good sleep, and social contact, results are often clearer. Pornography deserves its own section because it interacts with both conditioning and shame. Porn is a high-stimulation environment designed to produce intense dopamine spikes and rapid novelty. Over years, frequent exposure to high-intensity porn can condition the brain to expect those spikes. As a result, real-world sexual stimuli may feel comparatively flat. That's not a moral judgment. It's a neurobiological observation. For some men, a break from porn, a 30-day pause, helps reset sensitivity. For others, a gradual taper, combined with the reconnection protocol and attention to real-life intimacy, works better. The key is to experiment with compassion and to avoid punitive approaches. If porn use is entwined with compulsive behavior or causing distress in daily life, consider seeking behavioral therapy or sex therapy, because professional support can help untangle patterns safely and effectively. I also want to speak frankly about testosterone and broader physiology. Testosterone tends to decline gradually with age, which can affect libido, energy, and mood. Lifestyle factors, sleep, activity level, body composition, chronic stress, influence testosterone production meaningfully. The reconnection practice, combined with regular physical activity, especially resistance training, adequate sleep, and good nutrition, can support hormonal health without implying that every man needs medication. If low testosterone is suspected and symptoms are significant, that is a topic to discuss with a clinician who can order appropriate tests and guide shared decision-making about treatment options. I will not prescribe or recommend specific regimens here. Personalization and medical oversight are essential. Let me be clear about evidence and limits. Neuroplasticity is a real phenomenon. The brain changes in response to repeated experience throughout life, including after 60. Some studies have discussed links between ejaculation frequency and prostate health. Others describe the effects of high-stimulation pornography on sexual responsiveness. I will refer to these as supporting context, not as guarantees. If you see a claim in this video that refers to a large study, or some research suggests, please treat that as a signpost that evidence exists, but that individual variation and context matter. If you plan to use any on-screen citation or want precise numbers for patient education, verify the original source before presenting specifics. When should you seek formal medical care? If you have sudden changes in urinary function, inability to urinate, blood in the urine, severe pelvic pain, or if erectile difficulty is accompanied by chest pain, shortness of breath, or fainting, seek urgent medical evaluation. If sexual problems are causing significant distress, relationship conflict, or depression, make an appointment with a healthcare professional who can perform a sensitive, individualized assessment. Asking for help is not weakness. It's a practical step toward reclaiming health. I want to revisit the patient stories briefly, because they show how these principles work in practice without promising magic. Don Hector worked the slow touch practice into his routine for 6 weeks. He kept a private journal of sensations and avoided porn during that period. He told me his intercourse with his partner became less anxiety-ridden. He didn't claim miracles, but he reported feeling less shame and more curiosity. Don Roberto reintroduced regular ejaculation as part of self-care and also addressed urinary symptoms with a clinician. His pelvic discomfort decreased over months, and he reported improved sleep. Don Luis began seeing a counselor for grief and started meeting a walking group twice a week. His mood lifted, and he described small returns of interest in intimacy. Don Javier, 73, combined the reconnection practice with strength training and sleep optimization. His morning energy improved, and he felt more like himself. None of these men were fixed overnight. Each made steady, patient changes, sought professional help when needed, and avoided the extremes of rigid abstinence or high-intensity autopilot habits. There are common questions I hear and want to answer now. Will this protocol cure erectile dysfunction? No one can promise a cure, because ED and other sexual difficulties can have multiple causes: vascular, neurologic, medication-related, hormonal, or psychological. The reconnection protocol is a behavioral tool that helps many men regain sensitivity and confidence, and it often complements medical assessment and treatment. How long should I try it? Commit to a minimum of 30 days to notice trends, and if after that time you see no progress or your symptoms are severe, consult a clinician. Is ejaculation required? No. Ejaculation is optional in the practice. The primary goal is to restore sensory learning and decrease shame. What about partners? Invite your partner into the conversation if that's comfortable. Couples often benefit from shared intention and communication, though the daily reconnection practice is a private exercise to retrain individual neural pathways. A few practical troubleshooting tips. If you feel discouraged, remember that habit change is slow because neural circuits were built over years. If the practice provokes anxiety, reduce the time and focus on breath and body awareness first. If you notice pain, stop and seek evaluation. If pornography urges become overwhelming, professional behavioral support can provide structure and accountability. Track small wins. A better night's sleep, a less anxious morning, a moment of curiosity rather than judgment, because those are the real indicators of neural and emotional change. As we close, return with me to the one hard truth. Sexual health after 60 is not optional. It is a meaningful barometer and contributor to overall physical and mental health. Neglecting it, whether through conditioned high-intensity behaviors, rigid abstinence, or silence born of shame, has ripple effects beyond the bedroom. The hopeful news is that the nervous system remains adaptable, and small, consistent practices can tilt things back toward connection and vitality. You are not broken. You are not alone. The Reconnection Protocol is a modest, evidence-informed tool that many men use to retrain sensitivity, reduce shame, and restore confidence. It pairs well with exercise, sleep hygiene, social contact, and professional care where needed. If this message spoke to you, leave a question in the comments. I'll answer the most common ones in future videos. And subscribe to follow along. Thank you for trusting me with a topic too often left in silence. Taking the first small step is already a meaningful act of health.